And go.
Hi, my name is Beth, and I'm here to do the assessment for you. You came for a physical assessment today?
Yes.
And your name is?
Dawn.
Do you have any pain or concerns today?
No.
Okay, then we're going to go ahead and start.
Okay.
Okay, so I just want to inspect your skin first and see if there's any problems. You have very nice smooth skin and it's warm, and the inspection, I don't see anything upon first looking and inspecting your skin. Your arms look like they've got a little more sun than your legs, but you have some primary lesions, which are expectations for normal aging. And your skin on your legs looks like you have a secondary lesion, a scar that's healing here. Is that hurting you?
No.
Okay. And your skin's very warm. I don't see any edema. The turgor on your skin is very nice. There's no tenting, which means that you're well hydrated. Good job. And it's dry, nice and dry. I don't see any hair on your legs. Did you shave your legs?
Yes.
Okay. And you have sparse hair normally on your legs?
Yes.
Okay. Okay, and your nails are attached to your skin firmly. No problems. Your hygiene is very good. 1, 2, 3. I'm going to test your capillary refill right now, and it's very good. It's less than 3, so that's very nice. Okay, so now I want to inspect your hair. So I'm going to look at your hair. Do you color your hair?
Yes.
All right, it looks like there's some blonde and brown here. And I don't see any foreign bodies. Your hair is nice and clean. It's a little bit coarse. And you have curly hair, which is very nice. All right, I am going to look at your face now and inspect your face. Your face is nice and symmetrical. Okay, and I'm going to touch your sinuses. All right, you haven't had any problems with your sinuses lately, have you?
No.
All right. Pain?
No.
How about here?
No.
Okay, good. And can you raise your eyebrows for me? Very nice. Okay, now I'm going to fill your preauricular gland. I'm sorry, I'm having a little problem saying that word. And your post-auricular gland. And submandibular. And your submental. And then your occipital here. And then you have a chain that comes down here, and then a deep chain. But I'm not feeling any problems with it whatsoever. I want to let you know. And then I'm going to go ahead and fill your head and your scalp. Is that painful?
No.
Okay, that's your frontal, parietal, and occipital lobe. And that's very, I didn't feel any lumps or bumps there. Okay, so can I have you shrug your shoulders? All right, and then can you press your head against, good. Can you press your head against my hand? Perfect, that's very good. I was testing your cranial nerves. I also want to test your cranial nerves 3, 4, and 6. So I'm going to ask you to follow my finger. Very good, you did very good. Now, your eyebrows are symmetrical with your eyes. Your arch is where your iris is. Your edge of your eyebrow comes up against your edge of your eye in a angular fashion, which is very nice. And so it's very symmetrical. Can I ask you to look against the wall there? Okay, now my finger is on my shoulder. Can you follow my finger? Very good. All right, can I have you cover your eye, one of your eyes, and then look where my finger is. Now uncover your eye. Very nice, your eyes are going the same. Can you cover the other eye for me? And now uncover. Very good. They went the same. Okay. Now we're going to look at your pupils. And just look against that wall for me. Oh, I'm sorry, my flashlight was backwards. Let's try again. Look at the wall in back of me. Okay, your pupils are reactive to light. They're doing very well. Yes. Okay. Your sclera is white, your iris is greenish blue. Let's see, your conjunctiva is pink. I don't see any exudate. Your eyelashes are going up and outward. And I'm going to fill your lacrimal sac, okay? Okay, no pain there?
No.
Good, very good. Okay. Now, if I could, I'd like to look in your eyes. Since we're already on your eyes, I think I'm going to go ahead and look. Let's scan the room right now. Okay. Now I'm going to walk up slowly. You just keep looking forward. Let's see the red. Oh, okay, I see the optic. Oh. Okay, I see the optic disc. And it's darker around the edge.
I don't want to breathe on you, let me get a mask.
Oh.
I've been sick.
Oh, thank you very much. Oh,
Sorry about that.
I made your eyes water. Are you okay?
I'm fine, thank you.
Okay. Let me try again. I'll try the other eye this time. Okay, I see the red. Okay. Oh, it's nice and red. And I see the optic disc. And I see that it's darker around the edges. Okay. All right, it looks nice and healthy. And I think that we'll go ahead and look at your ears now. All right? Actually, why don't you keep the mask on for a moment?
Okay.
I'm going to try something else. I'm going to ask you to tell me if you hear this in your right ear, your left ear, or both ears. Okay? No? Tell me where you hear that.
I don't hear it.
Oh.
Both ears.
Both, good. And that's what you should be hearing. Okay, now I'm going to put it behind your ear. And you tell me when it stops, and then I'm going to move it, and then you tell me when you stop hearing the sound, okay?
Okay. Okay.
Oh, that's good, because bone conducts to less than air. All right. So now we're going to look into your ears. I see the top of your ear matches your eyebrows, which is what the expectation is. And it's nice and soft there. Your ear is very symmetrical. I'm going to turn this light on, and then I'm going to look into your ear, okay? Did I hurt you?
Uh-uh.
Okay. Well, I see some hair. A little bit of hair and some wax. And all right, and I'm going to check your other ear, okay? All right. Okay. I am going to go ahead and check your neck now.
Then we can mask off for now, or?
You can leave it off or you can put it on, whatever makes you more comfortable. Okay. So your neck is nice and symmetrical. Doesn't look like you're having any problems with it. Can you turn your head, your ear towards your shoulder? Your other ear towards your shoulder? Did you put your head back and then put your chin to your chest? Do you have any problems or pain with that? Okay, can you shrug your shoulders against my hands? Good. And can you lean your head against my hand? Perfect. How about this direction? Very good. Okay, I just want to test your cranial nerves there as well. Can you clench your teeth for me? Smile. Puff out your cheeks and then act like you're kissing your husband. Very nice. Okay, I was testing your cranial nerves there as well. Good, good job. And I'm going to fill your glands, and I think I already checked your sinuses. So that's your preocular, your postocular, submandibular, submental, your cervical chain, your deep cervical chain, okay, your clavicular, subclavicular. Okay, now I'm going to go behind you and I'm going to feel your trachea and your thyroid, okay? So you tell me if it's uncomfortable for you. Oh, you know what, I'm going to check your artery first. Just go ahead and turn to the front. I see no pulsations, no distension, and none there as well. Very nice. Okay, so I'm just going to feel your neck from behind. Okay, go ahead and swallow. Good. Now I'm going to pull up and try to swallow again. Very nice. I don't feel any swelling at all. Now I'm going to listen both to your carotid artery and to your thyroid. Now can you hold your breath for me? Good. You can breathe again. Listen to your carotid here. Very nice. Okay. And while I have the stethoscope, I wanted to go ahead and check your temporal as well, okay? It's right up here by your eye. I don't feel any problems there. But let me listen. Good. Okay. Okay. So I think that we're going to move on. I want to look in your mouth and I want to count your teeth. Okay? Did I forget to tell you to breathe?
No, I'm trying to catch my breath before I have to breathe on you.
I'm just teasing. Okay. Wanna open? Why not? $27. I see you have some fillings and you've had some dental work, but you have very nice, healthy teeth. Nice and white. Okay, and then open again. And then I want to just feel your palate and then your soft palate. Good. You have some glands in here as well. I want to feel. Perfect. Lift your tongue. Good. All right, your frenulum. Let me open your mouth again and lift your tongue. Good. Your frenulum's intact. And this frenulum's intact as well. Your gums are nice and pink. And your buccal mucosa is nice and pink and moist. That's very nice. Okay. So let me change my gloves. And I want to look in your ears. Oh, I looked in your ears already. I want to look at your uvula. Can you open your mouth and stick out your tongue? Okay, it's hanging down exactly where it needs to be. Say ah. Very nice. And it's moving up and down. Okay. Yeah, I have to look in your nose and see if your septum is deviated. Have you broken your nose before?
No.
Okay. So your nose is nice and symmetrical. You're not having any trouble breathing?
No.
Do you snore?
No.
Okay.
No. Sometimes.
Oh, okay. Okay, go ahead and lift your nose up. Okay. And there's some pink moisture in there. Are you having a runny nose lately?
Mm-hmm.
Okay. Well, it's nice and clear. And I think that everything looks good.
Well, thank you.
Oh, you know, I wanted to talk to you about the Snellen and Rosenbaum test. I think that I'm just going to defer that for now. I think that you've done that already with your ophthalmologist, and so we're not going to go ahead and go over that. But the Snellen test I want to talk to you about, that's where you sit and 20 feet away, you read a card, and you're supposed to read the 20th line. And if you can, then that's 20/20 vision. If you read any other lines, then that would need corrective lenses. And then there's a Rosenbaum test that's almost the same, but that is close up. So it's 14 inches from your face, and you would read that card as well. But since you've already done that with your ophthalmologist, I won't need to.
Okay.
Okay? Thank you, John.
Thank you.